Hi, Assalamualaikum warahmatullahi wabarakatuh to Madam Fauziah. My name is RUSNIDA Binti Jusoh, and today I will be presenting to you on persuasive speech. So my topic for today is stuttering in children is not normal disfluency. He is young, he is handsome, he can sing, his performance is energetic, he has the complete package as a superstar. Is there something that I missed out about him? The young man that I mentioned earlier is Harrison Craig, the winner of The Voice Australia Season 2, who starters. So actually he has had a stutter since the age of 3, and his confidence is shaken until he joined the reality show. So according to the Stuttering Foundation of America, there are more than 70 million stutterers in the world today, and the majority are children. My concern is a children may stutter as a sign of deficiency, or they really confront with speech disorder. Do you find stutters is adorable? But how can you be sure if the child has normal deficiency or stutters? Let's look at 3 effects of stuttering. First is interfering with child performance at school. Second is interferes with social and family life. And the third one, bullied or teased. So, why do we need to different the nature of stuttering? Because of the following. First is stuttering interferes with child performance at school. So according to the National Stuttering Association, 8 out of 10 parents say stuttering interferes with schoolwork and their children avoid speaking situations. The next one is stuttering interferes with child's social and family life. So children would often avoid to speak. They feel embarrassed when people know they stutter and do not discuss their stuttering with family and friends. The third one is child has been bullied or teased about stuttering. The result of the above, children may feel depressed, become silent and sullen. But there is a way. There is always a way to overcome these issues. First is a child with milder stuttering repeats the sound more than twice. A stutterer also shows the stress and struggle in the facial muscle, especially around the mouth. The pitch of the voice may rise with repetitions, and occasionally the child will experience a block which has no airflows or voice for several seconds. Next, once you identify that your child stutters, it is time to seek for advice from speech language pathologists. So, basically, speech language pathologists will diagnose your child by evaluating factors such as family's history of stuttering, whether the child's stuttering has lasted 6 months or longer, and whether the child exhibits other speech or language problems. Envision yourself following the step I outlined in the previous. What will happen to children when you are unable to identify or ignoring the problem? The first one, if if it happens that your children stutter, you might never know that your children may have other developmental speech problems. What I meant here is starting to talk late, have limited vocabulary, and not seeming to understand what is being said to them. Second, children who stutter will be laughed at, mimicked, or even bullied. According to Rustin Cook, Bottrill, Hughes, and Kelman 2001, stuttering is often portrayed as a joke in films and books. Next is the third one. Children would often avoid to speak. They feel embarrassed when people know they stutter. The result of the above, they may feel low self-esteem and lack of confidence. So, in conclusion, I urge you to start identifying your child's speech. Be concerned if they have some or all of the characteristics of stuttering. You should have your child assessed by a speech language pathologist to confirm. Get more information from Malaysian Association of Speech, Language and Hearing. Remember, your consent is the first step of prevention. Without any assistance, stutter may dominate the child's life, emotionally, socially, and educationally. So that's all from me. If you have any question, you may ask me for more. Thank you. My name is RUSNIDA Binti Jusoh.